பேர் விமலா. வயசு வந்து 45. எனக்கு வந்து ஒரு 4 மாதமாக சாப்பிட முடியல. 4 மந்த்ஸ் சாப்பிட முடியல. டீப் மூலயமா மூக்கு வழியாக தான் சாப்பிட்டுட்டு இருந்தேன். அதுக்கப்புறம் இங்கே அப்போலோ ஹாஸ்பிட்டலுக்கு வந்து எச்சி தண்ணி சாப்பிட்டா கூட எனக்கு இருமல் வந்துடும். எதுவுமே செய்ய முடியாது. ஒரு சொட்டு தண்ணி உள்ளே போனால் கூட இருமல் வரும். நான் இப்போ வந்து நல்லா இருக்கேன். டாக்டர் வந்து ஆப்ரேஷன் பண்ணி அப்போலோ ஹாஸ்பிட்டலுக்கு வந்த பிறகு ஆப்ரேஷன் பண்ணி இப்போ நல்லா சாப்பிட்றேன், நல்லா இருக்கேன். அவன் இப்போ எந்த பிரச்சனையும் இல்லை. தேங்க்யூ.
Hi, I am Dr. Shishir Shetty. I am the professor and head of the Department of Oncology at Apollo Cancer Center, Navi Mumbai. So recently we had a very interesting case, especially in these tough times. The son-in-law of the patient came up with a file saying that my mother-in-law Vimala is in a problem. She had a hole in between her trachea and the esophagus. It is known as a Tracheoesophagal Fistula, and that had happened because she was previously admitted for a long time in the ICU, and it was one of the complications she had. Now this lady was unable to eat because whenever she used to eat, the food particle used to go into her lungs, and at the same time there was a problem in her breathing because she used to get repeated chest infection. Now the unfortunate part is she recovered from the previous thing with this complication, but as of now the COVID broke out and there was a lockdown all over the country, and these patients had nowhere to go. They went from hospital to hospital, but because this was especially in the airway, and it is a very big risk to the anesthetist and the surgeons who are operating in that closed area, and such fine surgery has to be done. So we were thinking about how to go about it, and because this was sort of a semi-emergency and we could not have waited, so we put in our team together and we decided to go in for this surgery. It's a very difficult and technical surgery which involved opening the chest and the neck. The whole chest and neck were opened up. The area of the trachea and the esophagus is a part where you eat food, and trachea is the place where you breathe. We had to separate those two things and repair the esophagus separately. We took a piece of the muscle from the chest, put it in between, and covered that area so that it will heal well. Now this trachea, we actually cut the trachea from above and below. Now this becomes very challenging because when you cut the trachea, the patients cannot be breathing through their nose. So we had to put in a tube, and during the surgery we did all this manipulation. We finally got the two ends together and closed it. It's a considerably long operation, and we had a great team. We had fantastic anesthetists who could help us during this surgery, and she recovered well and she's discharged. I think you must have seen her. It's a matter of great accomplishment, especially in these tough times. We have been doing this tracheal surgery and esophageal surgery for a long time, and as our experience grows, probably we are more capable of handling such difficult and critical cases. Thank you.